Hi, Miss Curly. This is Babby, and this is my Bedsores assignment. All right, so my first question is describe which tissues are vascular and which are not. So, vascular tissues are the dermis and the hypodermis. Why? Because they have blood vessels. Now, the epidermis would not be considered vascular, it will be considered avascular because it doesn't have blood vessels. All right, now that that is explained, let's move on to the next question. How does a vascular tissue get oxygen and nutrients and get rid of waste materials? All right, so the avascular tissue gets the nutrients and oxygen and also removes waste through the process called diffusion. All right, so what diffusion is blood vessels found in the dermis right here, and they reach the tissue up here and they move through the fluid between cells, giving the epidermis the nutrients and oxygen it needs. All right, question number 3. State the effect of decreased blood flow in both vascular and avascular tissue and why. So, the decreased blood flow in both vascular and avascular tissue leads to damaged tissues or dead tissues. Why? Because there's a lack of oxygen and there's a lack of nutrients due to the fact that there isn't no blood flow. So there's no appearance in those areas of blood flow. So then the tissue ends up dying. Number 4. Describe appearance of bed sores. Explain why it causes this appearance and why it doesn't bleed very much. So I have an example here of a heel bed sore. They usually come up on many areas, but these are one of the common areas that it also comes on. So it is caused by a prolonged pressure being added right here. So it's caused by under prolonged pressure, and it appears to be red, and it's also open with broken skin, and it also has pus blisters. The reason that it doesn't bleed and it doesn't appear to be bloody is because the blood flow is constricting around that area. And so if the blood flow is constricting around that area, it technically means that the tissue is already dead. So that's why there's no blood in there at all. So number 5, as a healthcare provider, how might you reduce the risk of patients developing a bed sore, and why does this work? So as a CNA, I tend to rotate them every 2 hours to prevent these pressure ulcers. We also place pillows depending on where we might think the pressure ulcer might come. And this helps by applying less pressure on the area and just keep the blood flowing and circulating correctly. So this is my assignment. I hope you liked it. Thank you so much. Have a nice day.